Hello, welcome back. And in this short video lecture, we'll talk about some other finer points of coding conditions of the respiratory tract. We'll talk a little bit about guidelines, talk about strep, and ventilator-assisted pneumonia, and some others.
We're looking forward to that. That's Fox News multimedia reporter, Katie Schuyler.
Now we're going to talk a little bit more about some of the chronic lower respiratory tract diseases. A lot of these are very, very common and very common reasons for hospital admissions. These include such things as emphysema, asthma, and of course, COPD and bronchiectasis. If you're not sure exactly what these things are and what they mean, you may want to consult a medical dictionary. Chronic bronchitis, we've covered a little bit. I'm not going to revisit that. Emphysema, again, good review. A lot of times you see this in relation to COPD. And then, of course, we have COPD. COPD is the global term that covers diffuse obstruction of the smaller bronchi and bronchioles. It is a chronic condition. It never gets better. Some of you may know people, parents, grandparents who have COPD. It can be very debilitating. And it can be present with acute infection, such as acute bronchitis and obstructive asthma, emphysema. If we just see the term COPD with no other type of qualification, the code is J44.9. We can also have other types of COPD, J44.0. So again, if we have COPD with an acute lower respiratory infection, it is J44.0. COPD with an acute exacerbation is J44.1. COPD just as a one-word diagnosis without anything else, J44.9.
Moderate flooding possible during the high tide.
Asthma, we touched on a little bit, but let's dive into the finer details of code category J45. And again, most of us are familiar with what asthma is. It's this recurrent attacks with wheezing, spasmodic kind of contraction due to bronchi. This could either be allergic reaction, it could be a result of some sort of bronchitis, hay fever, or some other irritant. We may have different types of severity, and this is a very important slide here. I would like you to pay close attention to it. And one of the things that the pulmonologists like about this is this type of terminology is what they use. Intermittent, meaning that it's less than or equal to 2 times a week. Mild persistent,
This is an extreme cold warning for the rest of the weekend.
2 times a week. Moderate persistent, daily symptoms, severe persistent, several symptoms throughout the day, frequent severe attacks, right? And the 4th and 5th characters identify whether it's present with acute exacerbation and with status asthmaticus or uncomplicated type.
In the early recovery stages from last weekend's ice storm, there are still tens of thousands of people without power, and you're waking up to an effect.
And again, what exactly does acute exacerbation, as we mentioned in the weekly announcement, these are worsening of the symptoms. In other words, increased wheezing, shortness of breath. What status asthmaticus is an acute asthma attack in which the degree of bronchial obstruction is not relieved by the usual treatments, and this is a medical emergency.
That's the deep freeze.
Bronchiectasis is the chronic and usually acquired, but can be congenital, characterized condition where we get dilation of the bronchi as a consequence of some sort of inflammatory disease or obstruction. And the incidence of this has decreased due to widespread use of antibiotics, immunizations. Be interesting to see if this continues with the recent anti-vax campaign of our federal government. These codes specify whether it's present with acute lower respiratory infection, acute exacerbation, or if it's just uncomplicated. And we can, of course, have lung diseases due to external agents, right? These could be chemicals, this could be organic, this could be inorganic, black lung disease, these types of things. They're pretty basic in the sense that the main terms will usually get out there in front of it. For instance, did black lung disease, main term disease, and then looking for black lung under the main term. We can also have hypersensitivity pneumonitis. This is a disease where people breathe in irritants, sometimes referred to as farmer's lung, bird fancier's lung, malt worker's lung, all these other terms.
Any of that. The city will remain in a code blue until.
And of course, we have other different types of things, and some of these you may have heard of: the acute respiratory distress syndrome, the ARDS, acute pulmonary edema, chronic pulmonary edema, and pulmonary fibrosis. Right. So these are pretty straightforward, in my opinion. Again, the key thing is to look for the main terms, right? And then look for the qualifications about whether it's with or with a fistula, and so on. Category J95 are falling under these diseases and disorders that are due to post-procedural complications. And of course, anytime we give somebody a trach, this is the kind of thing that we're talking about. We're talking about the tracheostomy complications. Tracheostomies can hemorrhage, they can get infected. The stoma may not work, it may form a fistula, right? An inflamed opening close by, right? We can have post-procedural pneumothorax. We can have ventilator-associated pneumonia. These are very, very serious. We want to make sure that we code these. Main term for ventilated-associated pneumonia, of course, would be pneumonia. Then looking for ventilated-associated.
People with blood type O positive or negative.
Respiratory failure, of course, is a failure of the respiratory system to supply adequate oxygen or eliminate carbon dioxide. Usually it's a consequence of something else, heart and lung disease, sepsis, trauma, and so on. And you'll see divisions for these for acute, chronic, acute, unchronic respiratory failure. So important to read the documentation carefully. And the sequencing. People always have questions about the sequencing with respiratory failure. Think about why the patient was admitted after study to the hospital. If that's the case, it will be the principal diagnosis. In other words, the first listed ICD-10-CM code on the inpatient chart. There are specific guidelines for each chapter on obstetrics, poisoning, HIV, and other newborns that will require specific instructions about what gets coded. If a patient's admitted into acute respiratory failure with another acute condition, the principal diagnosis will not be the same in every situation. The key here is to read the documentation. So here's an example of what we're talking about. We have a patient with chronic myasthenia gravis and suffers from an acute exacerbation and develops respiratory failure. Patient gets admitted to treat the respiratory failure. Well, why was the patient admitted? It says right here, admitted to treat the respiratory failure. Therefore, we code the acute respiratory failure as J96.00. The secondary diagnosis would be the myasthenia gravis with acute exacerbation.
In Kill Devil Hills is where we find storm specialist Mike Seidel.
Here's another one. Patient with emphysema develops acute respiratory failure. Patient is admitted to the hospital to treat the respiratory failure. Again, why would they admit to the hospital? To treat the respiratory failure, J96.00. Secondary would be the J43.9 for emphysema. Now here's the third one. Patient has congestive heart failure brought into the ER with acute respiratory failure. The patient is intubated, admitted. Patient documents that the acute respiratory failure is the reason for the admission. If that's the case, then you've guessed it. The principal diagnosis would in fact be the J96.00. Right. So patient with status asthmaticus develops acute respiratory failure and is admitted for treatment of the acute respiratory failure. Once again, J96.00, we still would code the status asthmaticus. It's just not going to be the principal diagnosis. Okay, so this deals with the specific guidelines dealing with OB. So we have a patient that's admitted in the postpartum period as a result of developing a thromboembolism or pulmonary blood clot that led to respiratory failure. The principal diagnosis is the thromboembolism that occurred in the postpartum period, the 088.23. The secondary diagnosis would be the J96.00. And again, the reason we do this is that they're chapter-specific guidelines that require an OB code is sequenced first, as the Chapter 15 OB codes that we'll be visiting in a few weeks have sequencing priority over other codes. Here's another one. Patient is diagnosed as having overdosed on crack cocaine and is admitted with respiratory failure. Again, we see another chapter specific guideline where the poisoning code comes first, then the respiratory therapy. So we have that T40.5X1A, a 7-character code, poisoning by crack cocaine. It's poisoning per the chapter specific guidelines. Poisoning codes always come first. And then finally, and this is kind of calling back to our first week of class, patient is admitted with respiratory failure due to pneumocystitis carinii pneumonia, which is associated with AIDS. If you have this condition, you do have AIDS. The principal diagnosis per this chapter specific guideline is going to be the B20 code, and then we'd have respiratory failure and the pneumocystosis, psychosis.
And again, what it's doing,
and here's yet another one. Patient is admitted to the hospital with severe Staphylococcus aureus, methicillin susceptible sepsis, and acute respiratory failure. This goes back to the sepsis guidelines. Principal diagnosis is the methicillin susceptible Staphylococcus aureus sepsis, A41.01. The secondary diagnosis must be the severe sepsis. For those guidelines we covered in the infectious disease chapter, there's no septic shock, so it would be R65.20. And then J96.00 for the acute respiratory failure. Sometimes you'll see the term bronchospasm. This is a spasmodic contraction of the smooth muscle that are in the walls, the bronchi and the bronchioles. And an acute bronchospasm is usually a symptom of something else. Therefore, you'll see an excludes note under code J98.0 that states that this code is for a bronchospasm is not coded if the bronchospasm is specified with acute bronchiolitis, acute bronchitis, or asthma.
That's a perfect analog for this, isn't
Vaping disorder, again, a whole lot of new codes on these,
it? So in Maryland, all the codes-
falling in the U00 through U85 code categories.
Days where South Florida
Right.
goes. Sample was down in the
Again, these
20s.
codes are only started in the year 2020. They continue to get a little bit more explicit and detailed.
When you have these bomb cyclones, they will.
And again, the vaping disorder, a lot of interest in this. UO 7.0. And you can see now the level of detail that we can have: dabbing related lung damage, dabbing related lung injury, right? Lung damage due to e-cigarettes, all these things. Then again, we see a code, a note listed under the code to direct the coder when you use that vaping code, vaping related disorder for any abdominal pain, acute respiratory distress syndrome, diarrhea, drug-induced interstitial lung disorder, lipoid pneumonia, or weight loss.
Haley Meyer in Greenville. Haley, how goes it? There's somebody going slow.
So remember this, if the doctor identifies any of these different types of microorganisms along with it, those are the things that we code. And again, when does vaping related disorder, it's usually this is coded when it gets mentioned. This is a severe respiratory illness.
Far, well, maybe a couple of hours, and now it seems like we're back into cloud territory. Down a little bit south of where we're at right now, we had an official report.
And that's all I have for you. Thank you for watching, and we'll see you online. Bye now.